pleasure being invited to this, and especially getting a chance to talk to young persons like yourself and folks that I actually already know. So what I want to do today is I want to do two things. Tell you a little bit about how I got from there to here. My evolution as a public health professional and on that. And then also want to talk to you then about American Public Health Association, hopefully convince a good number of y'all to consider becoming student members of the association. I'll say more about that in a little bit. So I want to talk to you a little bit about the journey itself. So when we choose to be public health persons, a lot of times it's not something that we actually sort of woke up one day and said, I want to be a public health person. It really is a journey. It is a series of things that happen in your life that allows you to, or focuses you on what it is that you really want to do. Even my other degree, which is social work, it was not actually what I actually wanted to do when I first started out. So a little bit about myself. So the early years. So I actually grew up, despite the fact that I don't have the Louisiana accent anymore, I actually grew up in southeast Louisiana, which is actually a very rural part of the state. I was raised mostly by my family, so my aunts and my uncles were raised on that. We actually grew up in a very poor part of town. I am at the age where I remember separate but equal being actually the rule of the day. I don't know if y'all are familiar with that concept at all, but being able to have that as part of what we did. We did have unequal health care at the time. Of course, we didn't know that's what it was, but actually reality was that we had to really strive for that. So we have persons who would have challenges to their health care, do not have a place to go, and actually just basically suffered. A lot of home remedies, a lot of other things came up. The other thing is that then I moved, my daddy decided that he was going to try to do the parent thing and pull my brother and I to Southeast Los Angeles, which in those days was before the Southeast Los Angeles, I don't know if y'all are from that, but what you knew, which is again, moving from very poor, rural Louisiana to actually very poor inner city, big city, which actually was a, culture shock, is putting it mildly. For me, my brother he lasted less than a year, I lasted 2 years. And what happened was that we got in a lot of trouble, and mostly just hard time adjustment. We both ended up either in foster care or juvenile hall, and juvenile detention and other things, and struggled a little bit on that one. We were in systems where not a lot of resources were put into it, so we went through a time where unequal education, unequal health care was the norm. So we had a chance to really struggle in those things. So those are things that, at the time, we just accepted for the reality that it was. And so it really, at an early age, I was very fortunate, very blessed in a sense, because I grew up with my aunts who instilled in me the idea that life is what it is, and you should see those kind of things more as a challenge than necessarily as something that's going to hold you down. So people who were my peers we could actually one route was to try to do things that got them into trouble and things just didn't work and that sort of thing, or try to do things to work on improving yourself. So I was really fortunate because of before I raised to have that. So then I decided went to school, and not having the resources to really carry the school, we started on a program where I worked 2 years, I went to school 2 years and worked part-time, and put my way through schools on that. I lived in very diverse communities. I also had a chance at an early age to begin to work with people who were themselves very challenged, people who had parents who were incarcerated at some point or another, who were using different various substances to survive, just to get by day to day, involved in very religious types of things. So those kind of opportunities really influenced the shape of the world that I knew it. So I got a chance also because of, I don't know, maybe because I decided that I would speak up a lot, or I was very ornery, and people just decided ornery people make good leaders, and got asked to be involved with things that allowed me then to learn what it means to lead things, be responsible, take responsibility, and that sort of thing. So I worked on that, and then worked on issues where I worked with persons who had both physical challenges, mental health challenges, socially determined things that now we talk about as sort of the way we goods, but living those things. We literally lived those things at that time. And one of the things I would say to you, when you're in the middle of where these kind of social determinants related to unequal things related to health, to economics and those things, when you're in the middle of it, you don't always see it for what it is until you take a step back and realized that, wow, it is that serious, it is that challenging. But we sort of were more geared towards solutions. So I was really fortunate at the time to also be engaged, because of the push. Several of us were enrolled by circumstance in programs at the time they called poverty programs, which were all over the country. So we were at a time and a place. Because as a reaction, there were a lot of people who were pushing for these things. And so we were very fortunate to be involved with these programs. And so there, we actually learned a lot about things we never learned about before, which is how to have, what is a job, how to be responsible in a job, how to take responsibility, how to work hard, how to see these things as realities. Basically, just to get a view that despite how you grew up, there is an opportunity for you to actually do better. But the giving back part is where I really that bug really hit. And that had a lot to do with that part. So then I worked with that, and I did a lot of volunteer work. And mostly because I really wanted both to learn and also to give back. So I had a chance to do that. So I went to two-year college. And took a generalist approach. And to be frank, the reason why I did that is because having grown up and being in an unequal education system, my academic skills were really bad. And so I had to really do a lot of more remedial stuff than my other colleagues did. And almost, to be honest with you, flunked out of my first year in two-year college. And was able to get into a remedial program, and then from there, really struggled in first semester, but then after that, got really lucky. So then I went on to four-year college, and because of the work I had done, I decided one of the things that might be really good for me to do was to get into social work. And the reason is because I was both living the life, had lived the life, and also knew that if I could share ways and have ways to help other people who had been through things that I've been through, and try to give them an answer, because that's has always been a thing, is that people relate a lot to you if you yourself know kind of where they're struggling with and what they're going. And social work seemed to be the natural fit for me. And so I went to four-year college, was able to finish it. And then the opportunity presented itself about graduate school, which honestly, if you would have asked me just 2 years before that about graduate school, I had no idea even what graduate school was. And one of my professors and things thought that might be a really good thing, because at the time they were trying to get, if you know about the profession of social work, there's not a lot of diversity in terms of gender in social work. And so that was something that was really being worked on. So I was able to do that. And also I had a really interest in women, children, and families because of how I grew up, being raised being raised almost exclusively by very strong women and having really good examples of that. And saw myself as being able to work on that. So that's what I focused on when I went to graduate school. What just so happens, while I was at Berkeley, which trust me, when I got accepted into Berkeley, Happy Dance is putting it like mildly. You know, people heard me screaming down the block, on that one. Because, I mean, you have to kind of think about it. I had no idea I could get accepted into school like that, and I did. And so it was a phenomenal place to go. But when I got there, I also then began to debug for really doing good, solid research and good, solid evaluation. And so our school itself was very clinical. But the opportunity to do this, I took an evaluation class in the College of Public Health and got hooked. And really then worked with the professors to create a joint degree so I can get my MSW, MPH, and then work in the field. That's kind of what I wanted to do. So strong school on that. I did struggle with it a bit because academically I still had some challenges. It was coming over that. But at the same time was also a cultural shift. Coming from inner city Los Angeles, going to four-year college, and then moving up to the Bay Area of California, which, trust me, the rumors are true. It is that strange. And then except you live in San Francisco, then move to Oakland, and then you go back to a different way of looking at the world. So that's kind of how college worked for me. So then I began to work a long time. So about 32 years ago, I began to work both as a starter as a volunteer and began to learn from that. And I early on was taught because of the idea of try to learn from everything that you experience, because every experience you have, you can use it in some way, shape, or form. That was instilled to me very, very early in life, and to this day, it is something that I really pay a lot of attention to. So what I did is that I've done the work that I mentioned before, And then, as I went to graduate school, I was fortunate to get some really good professors, really good colleagues, really good friends, but more importantly, because I was working in the community, I worked both at a hospital and in the public health area, and was able to learn a lot from the people there and to see the kind of challenges that everyday persons were facing. So the reality is that if we could create programs and we could create opportunities for people who were struggling, that was something that I was able to work with people to do that, we could actually make a difference. And maybe not a huge difference, but that. In social work, the focus was mostly on individual at the micro level. On public health, the focus was on the macro level. I was a generalist, and so I was not a clinician. It was like, no way, I barely made it through clinical in my training because it was just not my interest. Sitting down talking to someone for 45 minutes, not me. But having a chance to work in community with other people, to see real changes and those sort of things, that really got that to do that. So I really focused on and got a chance to learn from many great people about applied participatory research. And then I focused on, because of the training that I got additionally in the hospital, learn about genetics. So I took genetic training and learned a lot about genetic counseling, genetic development, and then asked the question, what about public health? Can we apply these issues in public health? I also, at the same time, got a chance to work, because I was doing community work, on persons who worked in other countries. And by chance, I was asked to participate on projects who were people who were working in places like Africa, in South Asia, Eastern Europe, those sort of things. And they needed people who had skill sets, particularly research-oriented evaluation approaches and things like that, who could do modeling, who can do research and development. So I was fortunate to work with those folks and got on projects. To this day, I do now. I have projects on environmental health, in global health. I have projects related to teaching and training and development with that, so doing that. I also, because of personal reasons, became really interested in equity and social justice, because I see this all the time. One of the real challenges that we have in doing the work that we do is that we can only do so much. But we also have, when you look at the world is very complex. And so, we see so much around us that we really want to make a change for. So fortunately, getting involved with those things allowed me to focus on these two things: equity, not just disparities, but social inequities, which is the more systematic level of things, and disparities, but also then social justice. Being able to see that the law, that the approaches that we can use in academics and other things like that could really be able to make a difference in the short and the long run. And of course, having that opportunity, I was able to get my first teaching position out of a postdoc that I did at University of North Carolina at Chapel Hill into a teaching position at the school in maternal child health, and started working there and became very interested in teaching that as well as workforce development, because of a real strong belief that was instilled in me was that we could do a lot in terms of academic development and training, but those who are on the front lines really also need that support and do not always have the resources to get it done. So we were in a fortunate position. When I was here at UAB, one of the big projects that we had was public health training grants. And the other part of the things we had was also the opportunity to work in other kinds of settings to do that public health training. So we were very fortunate in that sense, and so we've been able to do that. So these are the places here, and I kind of list some of them that I've worked. I didn't want to go through the huge list, but this is the list that I have. 32 years, you end up with a lot of people in a lot of places. So, but it was Chapel Hill, UAB, Greensboro. I worked in local health departments, state health departments, medical schools. I worked and taught in medical schools in both here in the United States and in other parts of the world, because I got invited, very fortunate to do that, to actually teach in some of the places on that, South Asia, Africa, other places like that, mostly because of just the work that we did and the colleagues we developed as a member of APHA, which is the professional and academic leadership that I got involved. So as a student, about almost 30 years ago, I was really asked to start working with public health professionals. And those professionals themselves were very much involved in this association called American Public Health Association. And those were opportunities where I got a chance to meet a lot of people one of the big reasons I was able to do so much with so many things is because I met a lot of people. As a student, a lot of times I know for myself, I don't know about you all, but I know for myself, I volunteered for everything I could get my hands around because it was like such a great opportunity. These were like working with great people who did great things, and I think, man, if I can learn from them, that I could actually be able to make a difference as well. So that's how I got involved. So I spent a long time with them and worked with them. And then as an academic, I worked in ASPPH, which is Associations of Schools and Programs in Public Health. At the time, it was just called ASPH. That's where, as Dr. McCormick said, we began to look at this question of academic application of practice. What does that mean in teaching, research, and service? And we at the time didn't really have that because it was more of a like guessing game on this thing. So one of the things that ASPH came up with, it says we want to see if we can get the task force together, can actually incorporate this idea of practice and make it so that the level of rigor in practice is at the level of academics. So we began to work on that. So a bunch of us got together and developed a whole series of documents for that. And those documents are used to this day, if I know, and you all can access them by simply going to ASPPH and looking up competencies. And so we did that. We also did that because I was working in social work, public health social work companies. So we got a chance to do dual degree programs in multiple states. So as you know, UAB has a dual degree program with University of Alabama. If you don't already know that, we do because we started it. And we have that going, and we worked on those things. So. And then, of course, right now I work, because I worked here when I made Alpha, worked with Alpha. When I was in North Carolina, I worked with NCPHA, and now I worked with the, in the great state of Georgia, I work with the Georgia Public Health Association. So that's kind of that wise. So my predicament, taking all those things into account, was a couple of things. First of all was, how do I sort of develop and conduct the research and the work that was being done? So within a traditional environment of academic research and pedagogy, teaching, how do you do that? How do you be a practice person? How do you do practice work and still have that respected at a high level in a place that is very much driven by more traditional modeling? Well, part of it is the thing that I said much earlier, is that when you have that kind of challenge, you sort of make a decision. Do you let that drive you, or do you also take responsibility and try to do some changes? So what we did is that we decided to take responsibility. So we began to look at what are the scientific basis for things like practice, things like evidence, things like advocacy, things like apply that. And we found that there was these concepts and ideas called applied research and practice. There's these concepts called evidence-based public health, those kinds of things. So we said, then how do we make that work in that? So the focus then became, how do we incorporate that and use that to do things like grants and teaching and other types of activities? So that's how we developed it. So we took the predicament of how do you survive in an environment like this and at the same time do things that are going to make a difference in the world. Focus on outcomes, not just the research itself, but the outcomes of the research and how do you use that information. And using that information then to turn around and feed that back into your work, into things that you do. Because then you begin to see substantive things and substantive change that works in the world. So that was the real question, how do you do that? Research itself can make a big difference, but it only goes so far. If it's not used, if it's not understood, and if people do not have a sense of it. So we knew that, and so we wanted to work hard for that. So is it hard to do that? Yes, because you become what's considered a non-traditional academic, which I cop to. Is it harder? Yes. Is it successful? Absolutely. Absolutely. I can attest that as my own personal self and other people, that you can actually do this and do it very well. Good science within a certain context of the community, community not just a physical community, but communities of thought, communities of interest, communities of work, and then building trust. All these things matter. Because what they allow you to do then is to be able to have conversations, for the most part, with people who may not agree with you on matters. I have conversations fairly regularly with people who actually have totally opposite views on social justice and those type of things, but at the same time, we work together. We're able to find common ground, and we're able to pull things together because there's an element of trust there, and there's an element to saying that our purpose is to actually make a difference. So that's kind of what we do. So that's kind of part of the tradition. So let me take a switch there for a moment and start talking about APHA. What advice would I give to students who are contemplating becoming non-traditional academics? Don't do it. No, I'm kidding. All right. No, the thing that I would say is that there's a couple of things you need to do. The first thing you need to do is to make sure that you're good traditional academic, that your academic qualifications are strong, that you yourself have good scholarship, that you know what you're doing. You're a good scientist, that you're able to look at the world point of view, and that you could actually have a real conversation with pretty much anybody who does more traditional research. That's the first thing you do. So you have to really do that. The second thing is you have to be really clear about what it is you want to do. You know, is that because once you make the decision that what you're trying to do is make change in a direction that a lot of people may not be interested in at the time, you got to stick with it. You got to be willing to say, I'm going to stick with it, and also on that one. The third thing I would do would make sure you collaborate. Find other people of like mind, you know, who they are, because they are. Trust me, when we were starting the practice thing, you know, it was like two of us sat down and said, we really do need to make this change, because a lot of our colleagues were being denied tenure and promotion because they were practice focused, and we saying that wasn't good enough. So we began to have conversations with people that we knew do this, not just here at UAB, but other places as well. So build your collaborations, both within your own circle and then outside of your circle as well. And the fourth big thing that I would really say is that be prepared to know that it's a marathon and not a sprint. All right, because this is a thing that's going to have to carry you over. So I would really begin to do that. So if you did those things concretely, make sure your scholarship is strong, make sure that you have good collaboration, make sure you have other people that work with you, make sure you're really committed to what you want to do, and understand that it's going to take, you have to do things in the short and the long run. And sometimes you also have to do work that may or may not be within your wheelhouse. I survived a lot by having a very diverse research portfolio. That helped a lot. I just didn't get grants from one place. I got grants from all kinds of places, and I worked with all kinds of people. And sometimes I did it because I had to do that to survive. Majority of the time, over time, the more I did it, the more it related to me being able to do pretty much work on that. It didn't become an example. And so I would say the biggest thing that I would say do is once you get to a certain level, really, and this is just my personal advice, think about how you might give it back. Think about how those people like yourself that are coming up will learn to do this. Because the pipeline challenge is really one of our biggest challenges we have right now in public health. Having enough people who are willing who are knowledgeable, skilled, well-trained, and who are willing to work in public health and deal with all these challenges we have. So anyway, that's what I would do. All right, so let me talk a little bit about APHA. So what is it and how is it structured? So American Public Health Association is really, has been around for a good long time. It is now in its 146th year. It says 145, but right now we're going to hit 146 very quickly. It is an organization that champions for health in all communities around the world. The idea is that anybody who is a public health professional, it represents. Whether you are a member or not a member, it still represents you. And the idea is that we want to make sure that public health as a profession, public health as a science, public health as a way to look of supporting the way the world is really strong. We bring together members from all fields. You know, our mission is this. Our mission is a sort of broad statement, but it's to improve the health public to achieve equity and health status. That's a broad statement which can mean a lot of things, but specifically, what we want to do right now, our newest thing is create the healthiest nation in one generation. So that means that when you all are sort of at the generation before me, not when you get to or my age, then that's a different ballgame. But what you want to be able to do is that you want to be able to support this. So what you all are learning now and using now, we hope that you will take that. How are we structured? We are a very large association. We have roughly 25,000 members. We could have more because the profession itself as a whole has, at last count, some 300,000 people work in public health. So we are only the tip of the iceberg. And we would like to be able to get more people involved. But they work in public health in all sectors and everything. So we have a president, president-elect. We have an immediate past president. We have our board has these members. And then we have 3 members who are on the board, 4 long-term and 12 sitting. The executive director is overseeing our day-to-day business. We have a speaker of the council, which is our governing council, and I'll talk about that in a second. And then we have different emphasis areas, action board, science board, education committees on affiliates. And affiliates are state associations like Alpha and DPHA. We have intersections, and I'll talk about sections in a minute. And of course, then we have student assembly, which I'll also talk about in a minute. So we have a governing council. Now, governing council sort of represents or works as the House of Representatives for our association. There's about 201 of those persons, and they represent mostly sections and caucuses. In the caucuses, in the sections, or represent a whole slew of other areas of emphasis and disciplines and entrance areas within it. And within that, we have sections, and then we have the affiliates, which are the state affiliates. So all states have at least one affiliate representative. Some have two because of the size of the state. For example, California and New York have two people because they're massive and they have different sections. This governing council basically is the body that makes decisions about everything. For example, I had to apply to them when I was running for president, and they are the ones that voted for me to be in this position. They represent the 25,000 members. They go to them before they make decisions, and they come to that. So then they also elect us at the executive board, which actually is the executive group that oversees things that goes on, and then they approve any kind of adjustments we have to activities in the works. So the main activities that we have in this is in three different areas. One of them is science. So as an association that is involved with public health, we have a major emphasis on making sure that the science is sound. It's not just the advocacy part, but the science is sound. So we have an annual meeting, which hopefully some of you will be going to, or most of you will be going to. And you'll get a chance to see scientific presentations. You'll get a chance to interact with some of the leading people in the field of public health. And then bring together these ideas, cross-cutting ideas. We publish a couple of different things. We publish the Nation's Health, which is our newspaper. We also publish our own peer-reviewed, high-impact journal, which is called the Jamaican Journal of Public Health. We have special issues. We have special sections on that. The other thing that we do is throughout the year, we issue reports. And you all, if you want to, can get on the listserv. We have APHA Connect, which allows you then to interact with people, not just here in the United States, but around the world. One of the things that people need to know is that besides our 25,000 members, we also represent 40 countries that are members of our association. So when we have our meeting, we bring people from all around the world to come to there, and then more. And it's probably 40 is our kind of constant number, but we've had times where we brought people from places we've not really heard of. And they presented, they've worked together. So, and also they bring their advocacy. So for scientific sessions and research. The other thing that we do is that we take full responsibility as an association that represents the field to intersect and interact with people who make legislative decisions, like, for example, the ACA. And other things that goes on in our country related to legislation. We have ourselves as the executive board, but we also have within the association, we have persons who are our liaison on the Hill, who also have within the affiliates, we have persons who work with the affiliates, who work with states, and as well as national representatives who are making decisions. And these are just some of the areas in which we work with: MCH, bioterrorism, heart disease, diabetes, medical issues. We also provide anybody who wants it any type of education. If you ever go to our site, apha.org, we have phenomenal amount of information. You could use it for your own work, you could use it for education and that thing. So the action itself is very much that. And we do what's called science-based advocacy. So we do not just advocate because we believe very strongly in something, because we do. We think we do what's right, but we also have the science to back it up. So when you have arguments about climate, it's not just saying man had influence on climate. We have the science to give you and talk about that at work in pretty much everything. So then we deal with health, of course. So we believe that health is a right, period. There's no argument for us on that. We believe that every person has the right to health, has the right to live a healthy lifestyle, and have a right to health access to what they need to do. And we argue this all the time. So we then have a approach that we use called health in all policies. So pretty much every time we have a discussion with a legislator or other people on health issues, we try to talk with them about, here is the health angle on that. Often we have conversations. I have conversations with people about things that they didn't even know. I've had conversations with people who own construction companies and they end up talking about health and safety issues, and I keep reminding them part of the whole things around regulation and allow their people to be safe is things that we've advocated for as an association and work with legislators and other people to do. So we've been able in there. So we work at all levels. We also then champion prevention, of course, and we talk about cost effectiveness and cost efficient ways to improve health. So as components, APHA has 31 sections and on that one. We have 2 special interest groups. We have 5 different forums, which are basically intellectual think tank groups. We have 1 student assembly, and student assembly itself is our biggest group. If you join APHA as a student, you automatically get a member of student assembly. Has about 6,000 members to it. It is, I would say, if there's anything you want to know as a student involved in APHA or even just in health, period, it is the group to do. So I would say reach out to the people in leadership of the Student Assembly and get a chance to do that. There's all kinds of opportunities. It is basically the gateway into a lot of these things, and I think it will help you out a lot in what you do. So I would strongly encourage you to be involved with that. We also have 17 caucuses, which are semi-groups, where half the members are members and half them are people who work out in different arenas. And we have in those groups. So take a look at apha.org and we'll say more about that. So what do? So why is it important on this one? So we as an association work with other professionals and other groups to do things like we offer integrated education. We have persons who are interested in continuing education and other types of certifications that are at our annual meeting. We make sure that we provide and publish the latest on public health issues, both science as well as advocacy issues, et cetera, in our journal. And we also then have seminars, we have fact sheets, we have a lot of this information. Like I said, go to apha.org and type in whatever it is you're interested in the profession, and you'll see huge amounts of information comes up. You can also then we're all accessible, so if you go and talk to anybody in leadership, we provide both our names, we provide both our location, as well as our emails and phone numbers. The other thing is that we do is that we work closely with our states. And other members. We try to make sure that there is a level of coordination across states and with members about what's going on in terms of this, key decision makers. We are heavily engaged now in the discussion related to the ACA, and that discussion is, our position is that we should repair that ACA and look and see how ways we can repair it. Replacing is unrealistic, we know that. But repairing is very realistic because we know that it was, when it first came about, it was a compromise, to be perfectly honest. And in those compromise areas are where we know it could be strengthened. So for us, it's the repair on that one. We have discussions related to climate. We did not support moving out of the Paris Accord. And by the way, the annual meeting is going to be focused on climate issues as a bigger picture, but there's other things related to that as well. So if you do come to our annual meeting, which is in Atlanta, not that far away, you know, you can do that. So be thinking about it. You know, get the things. I don't know if the penny jars can help you, but I think other things can kind of help you on that one. Okay. So what else that we do then is we work on critical public health issues, and these are some of the issues. These are not all of them, but on this one. And our issues themselves are driven not so much by us who are in leadership to say these are the things we're interested in. Our members, both our members, our 25,000 people, as well as our states, and as well as you all in the public, drive the kinds of issues that we have. These are just some of them. And then as I talked some about some of these, but these are all some of these. And we also include things like gun control and other things as part of our issues as well. And we constantly, the whole idea of what's a public health issue keeps coming up over and over again. And we advocate for those things. All right, so why is membership so important? So I'll give you a couple different reasons. The first of all is that if you join, it's a movement to create the healthiest nation in one generation. It's an opportunity for you to lend your voice to both influence and educate policymakers, other people. We have a chance then to grow as a professional. We have multiple ways to do that through our continuing education through our webinars, through our journal, through Career Mart, which actually is extremely successful. It's amazing. I look at Career Mart every year I go, and the amount of jobs and amount of opportunity that's presented in that. And as a member, this is free to you. You know, it's bring your resume, talk to professionals. Literally, people who attend the meeting are the people who are hiring, and they can do that. And also other opportunities to present yourself, so be able to do that. You could also then do what I did, as I mentioned before, when it was asked by this young lady about this collaboration. This is that thing. I know a lot of people in the field, primarily through my affiliation in the association, and able to really do that. And so I've, of course, been able to benefit from that by becoming president. However, many people I've known over the years have done this. And we've had some phenomenal people in the field on this one. So, and sort of full disclosure, this is the pricing on that one. You all as students, as you can see, if you look at all the pricing, this is the lowest number here. The nice thing about students is that you're a student for this per year, but when you are no longer a student, you get an extra year at this rate if you decide to join. So you can join at any level, bachelor's, master's, doctorate. As long as you're a student, this will be your rate, and even a year or two afterwards, you still get to have those dues. So it's a reasonable thing to join, and it's also given the opportunities that we have. So again, networking opportunities, professional development, participation in member groups, publications you get, and you can get either the hard copy or the what's called green copy, which is actually the online copy of both our Nation's Health and our journal. Programs, we also have scholarship opportunities if you're interested in working, say, in government at all levels, both here in this country and other countries. There's scholarship opportunities there, career resources, and then jobs. So, what is it that we think are critically important? Well, first of all, we're focused on the healthiest nation, as I mentioned before. The other thing is defend the Affordable Care Act and expand health and coverage. We're looking at things that within that, like reauthorization CHIP, which is a child health program, protect Medicaid and Medicare. We're looking at the prevention fund, which is something that people do not know much about, but it's an opportunity then to focus on the priorities of public health. The other thing it is that we want to stop block grants to states, because we know what happens with many states when they get the block grants. They almost disappear, or they get used for other things, not public health. And so we want to build Public Health 3.0, which is why, talking to you all, we're hopeful this, because you all are Public Health 3.0. You will have opportunities for leadership, be involved in funding, accreditation, and these things. But we also then know that we are changing the face of public health. And what we need to be able to do is to have all these things working in tandem. The other thing is that we want to look at issues right now that is one of our leading challenges. As you know, I live in southern Georgia, and we did get the we didn't get the brunt of it, but we got a really good smack by Irma when it came through, and that affected us big time. But it's the science that tells us that these things are increasing in both volume and intensity, and it's rare to have five huge storms come right after each other and all of them be Category 5. That is unheard of historically. So there is a lot of issues we need to deal with. So climate change and environmental needs. And environmental needs are not just things like storms. There are other things too, like Lowndes County, which y'all have in the state. The whole issue around how do you deal with land that is not owned by people but are expected to keep it up. However, things like lack of sewage and other types of things is going on. So there's a lot of things around environmental justice that we also need to pay attention to. So the other thing is that our agenda has become that, is that we want to stop regulatory rollbacks, which is affecting us. We want to protect women's health, because we believe that and access to reproductive health is critical. As last year at our meeting, we had Planned Parenthood come and talk, and we had a number of other people on both sides of the issues come and talk to us, because we believe very strongly in open conversation, which is what we need. So whatever the crisis of the day is, it's an open conversation, and we want to be able to listen to both sides, deal with both sides. We are very strong advocates, of public health issues, but we recognize that our view is not the only view, and that we really honestly need to have conversations with people and have honest conversations with them from other points of view. Otherwise, we get nowhere. We have gridlock, which is what we have now. We can't live with that. We can't make change. Nothing happens in gridlock. You need to be able to do that. All right, so the other thing is continued equity work we do, dealing with racial and ethnic issues, discrimination issues, income, geographic, and then social discrimination work. So geography is something that we don't talk a lot about. People living in rural areas and the challenges that they face. But if you look at right now, where are some of the biggest challenges that we have, like opioid addiction, sanitation, other issues? These are in geographically isolated parts of our country and other isolated parts of the world. And we really be able to look seriously at those things. So we do that. And then our shared priorities is addressing these things in other ways. Our biggest thing here is strengthening the public health workforce and then making sure that those opportunities are there. So in closing, I just want to talk to you, say a quote, one of my favorite quotes. And it's something that I think you can relate to, but I can relate to it a lot because it is really a reflection of what I've shared with you about where I've come from, what I'm doing now, and how I've done it. So this is a quote from Booker T. Washington, who himself was a great advocate of great civil rights and educational advocates. And what he said was, success is to be measured not so much by the position, what it has reached in life, as by the obstacles which have overcome in trying to succeed. And so it's a message that I see of our times, and then we as members of public health, I think, understand that quote so well. Because it is how we ourselves have made it work for us and how we leave our mark and how we leave our impact. But we also know that if we're going to leave an impact, we have to think about things like sustained and real change, and in the short run, as well as the long run, because we do want to leave an advocacy, a legacy on this issue. And that's what I have. Thank you.